Hello, my name is María Mateos and I work as physician in hematology in the University Hospital of Salamanca in Spain. We are now in Paris in the 13th International Myeloma Workshop, in which a session regarding treatment in elderly myeloma patients has been already completed, and I'd like to share with you the most important comments obtained from this session, in which different investigators from different countries in Europe, in the United States, have had the opportunity to present their results in the trials conducted in this elderly patient population. I think the most important conclusions are that first, elderly patients are a very fragile patient population. Novel agents-based combinations are demonstrated to be very effective in this patient population. Bortezomib-based combination, lenalidomide-based combination, and another new drugs that they are emerging in the treatment of relapsed and refractory myeloma patients. They are already moving to the treatment of newly diagnosed myeloma patients, and especially elderly patients. For example, carfilzomib, HDAC inhibitor, elotuzumab, vorinostat, etc. However, I think one of the most important conclusions is that elderly patients are fragile patient population, and so treatment should be individualized according to the characteristics of the patients, not only according to the chronologic age, older than 65 years, but most importantly according to the biological age of the patients, according to the comorbidities that patients are presenting, and it's important to take into account all these aspects in order to choose the best appropriate treatment according to these characteristics. It's very important to modulate the dose and schedule of administration of these novel agents. And for example, the weekly administration of bortezomib resulted in a significant reduction in the peripheral neuropathy rate. The administration of low-dose dexamethasone was associated with a significantly lower frequency of serious adverse events, and the same occurs for other drugs in this patient population. Another point to consider in the treatment of elderly myeloma patients is if it's whether to give then as treatment a double or a triple combination in elderly patients. From my point of view, probably a triple combination, including a novel agents, could be very attractive for this elderly patient population because they can achieve complete remission, and complete remission is an important surrogate marker for progression-free survival and overall survival. However, there are other possibilities of the combination of only two drugs, and one clear example is lenalidomide plus low-dose dexamethasone, that it has been demonstrated to be very effective in elderly patient population with a very good tolerability. So if you have to choose a triple or a double combination for our elderly myeloma patients, I think it's important to consider the comorbidities of the patients, the performance status, the biological age of the patients in order to choose the best option of therapy for each patient. Another issue, another aspect to discuss in the treatment of elderly myeloma patients is the autologous stem cell transplant. It's probably to perform autologous stem cell transplant in elderly patients, in patients older than 65 years. However, it's important to consider even more the chronologic and biological age. To perform an autologous stem cell transplant to a patient older than 65 years, patient has to have a very good performance status without any comorbidity, and he has to be a very fit patient. Why? Because, for example, in our experience in the Spanish myeloma group, we decided to conduct autologous stem cell transplant up to 70 years, and we have had the opportunity to see that the transplant-related mortality was significantly higher among patients between 65 and 70 years, and especially the mortality rate increased up to 8% in the patients between 69 and 70 years of age. So I think we have on our hands a lot of novel agents-based combination that they can result to be very effective in elderly myeloma patients, avoiding the possibility of autologous stem cell transplant if the patient is not very fit in order to receive it.